So I thought just to start off with not knowing the world about Ontario, we could just see how close we are. So let me ask you this. Do we have a shortage of acute care beds in Ontario? Put your money where you're... So 3 people think so, and those that think there's plenty of acute care beds. There's only 3 people here today? Come on, come on. Be brave. Who thinks we need more acute care beds? Okay, more brave people. Who thinks there's plenty and enough? Okay, I think it's pretty close to half and half. Obviously in Alberta they think they're building the Mazankowski Center, they're building another huge $1.2 billion hospital in South Calgary. There's people that do think we need more beds. We have a shortage of long-term care beds. Oh yeah, now we're getting it. We have too many long-term care beds. I guess I would be the only one then. So we'll talk about that. We have a shortage of doctors. We have too many doctors. Okay, you know, I don't know in Ontario, but in Alberta, there's one general practitioner for about every 1,000 to 1,200 people. If you take most of the good HMOs or like Intermountain Health, VA, there's probably 1 to 1,500, 2,000. So imagine if that capacity changed. I wonder if we really need the doctors that we have. We've talked about that too. Nurses. We need more nurses. We got too many nurses. I guess it depends where they are. I have 3 daughters that I love dearly that are nurses. None of them are working right now. They found something else to do. So maybe there's something wrong with our system where my good nurses are doing something else. We need more chronic disease clinics for sure. Okay, hopefully we can get to that. We need more urgent care centers rather than hospitals. Few. We don't need them. Okay, the dues will need more staff. We're understaffed in the emergency in all these different places. Who's from emergency here? Yeah. Are there any wait lists in the emergency? I know in some places in Alberta, people wait for 3 days in the emergency before they can get a bed after they've been admitted. Is that happening in Ontario, or is that just in Alberta? It happens here too, yeah. Mental health workers. Boy, isn't there a shortage of mental health? I want to tell you about an experiment we did in mental health that makes me wonder about that one too. So this is our region. We come from the very south end of Alberta. We have about 180,000 people, with Lethbridge being the center. There's 10 communities around it. And so I kind of think it's a little bit like you guys, except you're more far-flung and you're probably bigger, twice as big. But it's still, you have a chance to do something because you have a regional center and you have the network around. And so, yeah, that's turned out to be very valuable. What I noticed about it over the years, it seemed to me that we were small enough that we could do things. I mean, big enough that we could do things, but small enough that that we actually could get the people together to do them as well. Whereas when I looked to see the bureaucracy of some of the bigger centers, it was really hard for them to move. So why I say this, I just want you to know that in some ways you have a great advantage being in a regional center like you have, because you can try things that some of the big centers have to go through years of bureaucracy before they can get the changes made. We had a board, which they have got rid of now, that was very supportive, but we had to, you know, we spent time working with them so that they would understand, and they were so supportive in the things that we did. So what have we done that maybe is different, and you can relate to those questions I just asked? In the last few years, we've decreased the number of acute care beds in our region by 40%. We've decreased long-term care facility beds. Now, we haven't quite done that. We're probably only at about 50% now, but with the buildings that are in the ground at the time of this happened, when they're finished within the next 18 months, we'll have decreased long-term facility beds by 70%. We've, at the same time, increased surgery blocks by 30%. And sometimes we've had, in some months recently, we've had like 22 empty blocks go begging for the surgeons to use them. And I must tell you that there's not a better recruitment tool in the universe than surgeons knowing that they can do their trade. I know that we had a review by Deloitte and Touche, and there was some people from Nova Scotia that came and said, "Where's my recruitment book?" Because, you know, every place you went, you have to have a big recruitment book on how to recruit people. And I said, well, the recruitment is just making sure that they can do their trade, and so I got bad marks on the accreditation. Yet on the other hand, we're not looking for any surgeons. We've got 2 internists coming. We've got probably 10 more general practitioners than we need in Lethbridge. So there's nothing like having opportunity for these people to work that recruits them. So it's made a huge difference. In our primary care clinics, where most of them just 2 years ago would be sitting with 6 to 8 weeks delay, I'd say the majority of them are same-day access now, which has been good. And mental health, I kind of alluded to. At the same time, we went through the advanced access program, and our mental health workers did it as well. And finally I thought, well, we can do those processes as well. And where our delay to get into mental health clinics was like 3 months, they're down to about 3 days, 1 to 3 days, depending on which clinic it is throughout the region. And so I think, you know, I have a good friend whose daughter is schizophrenic. And he said to me many times, he says, Vernon, it's not getting people in to see the doctor that's my problem. It's the mental health nurse that I got to get into. But if I can't get in there for 3 or 4 weeks, then my daughter fails and she ends up in the emergency and she ends up. And so it's been a huge advantage now to have, you know, between 1 and 3 day waiting time for our mental health clinics. And it also speaks to that question, you know, do we need more mental health workers, or do we need to change the system by which they work? The other thing that's we did is that in the past year, it's been the first time in 100 years that the number of emergency visits to our regional hospital has decreased. I mean, it's just like clockwork. You can pretty well count on, you know, people getting older, more people moving into the community, you know, people coming to Alberta because it's oil or whatever. And but the hospital visits have gone down as well. And I think that relates very much to the access people have to primary care. And also, we were probably the most in-budget region in the province. And so a lot of the changes that are coming about in Alberta are our fault, which bothers me badly because I don't like them. But what they're trying to do is to push some of these ideas to the rest of the province. So I'd like to spend a few minutes and talk to you about, I guess I don't have to do that. So acute care beds, here's some of the beds we were. We were at about 558 and we're now down to 303. You can see that there's lots of communities and there's a few zeros there, and those have been some wonderful experiences as I've been nail shutting courthouses with 6x6 2x4s as you go to a community to close their acute care hospital. But in pretty well every case now we have pretty good support, and we had 100% support from the medical directors in doing that, which helped.